Good evening, everyone. I am Vivek Nair. I'm a physical therapist and I'm currently working at Neuron Brain and Spine Institute, Navi Mumbai. And I'm also an active member of Asha Eco Foundation. Today, we are going to talk about neck exercises for patients with motor neuron disorder. So, what is motor neuron disorder? Motor neuron disorder is a group of progressive degenerating disorder in which motor neurons slowly degenerates and dies. These motor neurons are responsible for carrying out all the voluntary muscle activity like walking, speaking, swallowing, breathing, and even gripping. One of the most common symptom that is noted in motor neuron disorder is neck drop, which is also known as drop head syndrome. Mainly, it is caused due to the excessive weakness of the neck extensor muscles. So today, we'll be discussing about all the exercises that can help in maintaining the neck muscle strength. So, you can see the board that I've kept behind me. So these are some basic exercises that we can do to maintain the strength of the muscles of the neck, which will in turn maintain the alignment of the neck. So to show all these exercises, I need a model. So please, can I have a model? Yeah. So before we start with all the exercises, for all the audience out there, I would like to ask you to just bend your neck forward, down, bend your neck down. And now try to speak. बात करने को try करो, bend करके and बात करने को try करो. I'm sure it is difficult for you to talk with your neck flexed. Now try to swallow. It's even more difficult. So when you are keeping your neck flexed and you're trying to talk or swallow, it becomes very difficult. So imagine with a person whose neck is in constant neck flexion posture. Okay, so this will definitely trigger the deterioration rate in MND patients in long run of days. So all these exercises are focused to maintain the neck muscle strength, which will in turn maintain the alignment of the neck. So we'll start with chin tucks. Chin tucks is very basic and easy exercise. In this, you just have to push your chin posteriorly. Just imagine a piece of grape which is kept between your throat and your jaw, and you just try to squeeze it in. And then hold it for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. This position would be difficult for you to understand, so I'll just ask him to stand up. Turn sideways. Now keep your hand in this thing. Now try to push your jaw in on the thing and hold it for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. The same exercise you can do in sitting, standing, or lying down. When you're lying down, you can just roll a towel and keep it under your neck so that you're comfortable, and then do the same activity. I'll just show you now. See this? Same thing under the neck. So the same exercise can be done in lying down position also. And hold it for 10 seconds. Relax. Yeah. Now we'll move to the second exercise. Second exercise is scalene muscle stretch. Scalene muscle is a very important muscle. So what happens is when your neck is in forward posture, so it may go in contraction. So if you start stretching the muscle from this from the initial phase itself, you can prevent the contraction in later phase. And scalene muscle is also an accessory breathing muscle, which may in turn improve your breathing rate. So to stretch the muscle, this muscle is present laterally. It is kind of inverted Y with an extra leg. So it runs behind your ear to the shoulder. To stretch the muscle, what you can do is, suppose you are stretching the right scalene muscle. You stabilize your clavicle and extend your neck up. Look at the ceiling and then do lateral flexion to the opposite side. And try to touch the ear to the shoulder. When you do this, you get a good stretch in your scalene muscle. And you can hold this for 30 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, and 30. So, while doing this stretch, you have to ask them whether they are feeling any kind of discomfort. If they are feeling any kind of discomfort, you can ask them to stop and take some rest. Now, we'll move to the third exercise, which is upper back strengthening. A lot of people fail to understand the importance of upper back strengthening. Normally, you might see a lot of patients with a rounded shoulder. When they have rounded shoulder or weak scapular muscles, automatically their head also goes in forward sloping. Okay, so if you strengthen your upper back, you already get an erect posture, which may also improve the alignment of the neck. So one easiest exercise is to keep your elbow in flexion, 90-degree flexion, and with your palms in a fist-like position and thumb facing upward. Now rotate the thumbs laterally and now take it outwards. When you do this, you feel a good squeezing like movement in your back. Okay, so just to make you understand even the easy way, you can see how the scapular blades are squeezing together. Okay, you have to hold this for 10 seconds and then relax. And then again, rotate laterally and then take it out. And hold this position for 10 seconds, feel the squeeze and then take it in. Relax. So this can help you improve your scapular muscles, which will give you an upright posture and which will help you maintain your neck posture also. The fourth exercise is sit down. Isometric neck exercises. For all the movements, flexion, extension, rotation, and lateral flexion, you can give isometric exercises. So isometric generally means that the length of the muscle won't be changing. So I ask the person to push his head on my hand, and I'm resisting his movement. So while he's pushing, he has to hold the push for 10 seconds. Keep pushing. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Similarly, the other side, lateral flexors. Push. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Similarly, for the flexion, you keep it on the forehead and ask the person to push it. Push. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And now posteriorly for the extensors. Push. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. These are very easy exercises to be done, especially for the patients who have mild symptoms. So you can do it, but at any point if the person is feeling any kind of discomfort, let them take break, let them relax for a while, let them take a 10 seconds break, and then you can continue the exercise and finish the task. And now we'll move to the fifth exercise, which is active neck flexion and rotation. Active movement is nothing but the normal movement which you are doing against the gravity. So I'll just ask him to get up, and now just ask him to do the active movements. So okay, up, down, up, down. You can just make them do neck extension and flexion for 5 to 10 times. Similarly, the rotations. Now rotations. Left, right, left, right. Similarly, you can make them do side flexion. Active exercises I would suggest active exercises for patients who are having moderate kind of symptoms. At the end, I'll explain you which all exercises will be beneficial for patients with mild symptoms or moderate symptoms and for the severe symptom patients. Okay, sit down. Now we'll move to the sixth exercise, which is active assisted resisted. So in this, I think you can't see the board, so I'll just keep it on this chair. I hope it is visible now, and I'll go to that side. Okay, so we are going to, I'm going to show you now 6 exercises, which is active, assisted and resisted. So what happens in some people, the range of neck flexion and extension. Suppose my range of flexion and extension is from this to this. So in some people, for initiating neck extension, the initial rate, 5 degree, it might be difficult for them, or it may take them a lot of effort to just lift their head initially. So if I assist them here, then they have enough strength for them to lift their head posterior. Okay, so in this kind of exercise, what I can do is, so initially, without them taking a lot of effort, I just assist them in the initial phase, and the rest of the range, I'm giving them resistance because they already have muscle strength in that particular range. So now push, push back, push back, push back, push back, push back, push back, relax. Now I assist them initially, and then push back, push back, push back, push back, push back, push back. So whenever you're making a person do this kind of exercise, when you move their head, you see at what range they can do the activity without any taking much of an effort. So if they are taking effort in any particular range, you have to assist them, because if they are taking too much of effort, they might end up having muscle fatigue, and which will also result in muscle weakness. Now we'll move to a seventh exercise, which is active assisted and passive exercise. So in active assisted, the same thing. You have to see which range the person can do the movement actively. If he is able to do active movement till mid range, then the rest of the movement you can just assist him. Or else, if he is having difficulty in doing the movement in the initial range, assist him, and then at the end range, he can do. You can make him do actively. Same way in rotation and side flexion also. So it's up to you to decide at what range you have to give him assistance. So when you make the person do the activity, you can understand at till what range they can do it actively, and where they require too much of effort, where it needs to be assisted. Now I'll move towards the eighth, which is manual traction or mechanical traction. So manual traction or mechanical traction is something that I would advise you all to do by yourself, because it will require you a trained professional to perform that. So it is basically giving traction to your head. So this is done mainly in the supine line, and the therapist will be standing behind the head and pulling towards his body. So, and in mechanical way, there will be a strap which would be kept around your neck, and which pulls it constantly and holds it in the particular position for 30 to 40 seconds. So this mainly helps you relieve all this tension caused by compressive force because of prolonged forward stoop posture of the neck, and also helps you to relieve pain caused by the spasm. And now I would like to tell you which exercises would be applicable for which phase of the disease. So normally, to make it a little easy, I'll divide the disease in three particular phases. It's like mild, moderate, or severe. So the initial three, you can do the chin tuck, Scalene muscle stretch, upper back strengthening, isometric neck flexion, extension, and rotation. You can do easily for the mild phase, patients with mild symptoms. For the moderate symptom, I would suggest you to focus more on active neck flexion and extension exercise and rotation exercises. You can also do isometric exercises for patients with moderate symptoms, but for you to do it for 10 times at a stretch would be slightly difficult, or you might require more effort. So you can do like 5 times and then take rest, and then again 5 times, and then focus more on active exercises. And then active assisted resisted exercises will also be more applicable for patients with moderate symptoms. And at last, patients with severe symptoms would be benefited by active assisted and passive exercises. So I'll show you something in this. For patients with severe disability, they will have very poor muscle strength over the neck, so it becomes very difficult for them to actively perform some activities. So what we can do is, you can make them do exercise in gravity eliminated posture. That may be in side line, keep a pillow, suspend their head using your hand, make them rest their head on your hand, and then ask them to do neck flexion and extension in side line position. Just to make you understand that a little clearer, I'll ask my model to come back one more time. Just side line. Okay, so in this sideline position, there is no role of gravity playing in his movement. So in this, I have completely eliminated the gravity, and now I can see if he has any active movement in the muscle. So I'll ask him to do neck flexion and extension. So to whichever range he is able to do it actively, I let him do actively, and rest of the range I'll be assisting him with flexion and extension. Okay, yeah. So same way, if there is no active movement at all, you can do the exercise. You have to do passive movements, and passive movements will help you prevent all the complications of swallowing, speech, and breathing also. So it is very important. And okay, thank you. So another thing that I would like to talk about is to prevent complication. Neck bracing is very important. It plays a very important role in maintaining the neck alignment and keep your neck up straight. So what happens, like initially, which I told you, when you keep your neck bent for a longer period of time, it becomes very difficult for you to either speak, swallow, or even breathe. So these neck collars, there are different kinds of neck collars available in the market. There are soft collars, there are hard collars, and there are now very modified collars which also allow your neck range of movement. So which will not allow your muscle weakness and maintain the strength of the muscle also, which are slightly costlier than the normal regular soft collar or hard collar, but it does its work very well. So even if you just wear your neck collar, a hard or a soft one, you maintain your alignment of the neck, which helps you to maintain your swallowing, breathing, and speech function. And another thing I would like to tell you is, all these exercises are mainly to maintain your muscle strength, which in turn will maintain your alignment and would help you to improve your quality of life. Like if you are not doing all these exercises, you might get deterioration of your speech and swallowing much earlier because of forward stooping posture of the neck. And if you do this, you can prevent it from having an early deterioration in your speech and swallowing. And for eating and all the other activities, if you have a drop neck syndrome, it is better to also take advice from a speech therapist and consult a speech therapist and do swallowing therapies. That is also very effective and would help you to improve your swallowing. And I think that sums up pretty well, and we can move for a question and answer round. If you have any doubt, please shoot all the questions that you want to ask. I would be glad to answer all the questions. So I think it's taking too much of time and there are no questions currently. So if you have any queries, you can contact Asha Eco and we'll be glad to answer your questions. Thank you.